Know diabetes risk factors and how to control it. Diabetes is a chronic disease characterized by high blood sugar levels in the body. This condition occurs because the body is unable to produce enough insulin or use it effectively. Insulin is a hormone that plays a role in regulating blood sugar. The risk of diabetes can still occur in people who are still young, especially if they have the following risk factors. People who are overweight or obese are at risk of developing diabetes. This happens because excess fat tissue in the body can make it difficult for the body to use insulin effectively. This condition is called insulin resistance. In addition, obese people are also at high risk of developing metabolic syndrome, which is a condition that can trigger diabetes. Not maintaining diet. Everyone, whether children, young adults, or even the elderly, will be at a higher risk of developing diabetes if they do not maintain their diet properly. The habit of frequently consuming sugary drinks or foods, soft drinks, and rarely consuming fiber, such as fruits and vegetables, is known to contribute to increasing the risk of diabetes. Lazy sports. Infrequent exercise can also increase the risk of developing diabetes in young age groups. This is because the body is less able to use glucose effectively as energy if you rarely move or exercise. As a result, blood sugar will tend to increase easily and difficult to control. Genetic or hereditary factors. Genetic or hereditary factors are one of the risk factors for diabetes. Therefore, the risk of developing diabetes at a young age can also increase if you have family members, such as parents or siblings, who also suffer from this chronic disease. Certain diseases. You are also at risk for diabetes if you have certain diseases, such as hypertension, high cholesterol, metabolic syndrome, or polycystic ovary syndrome, PCOS. Control blood sugar now. To prevent or reduce the risk of diabetes, you can take the following steps to control blood sugar levels in the body. 1. Check blood sugar levels regularly. Blood sugar checks can be done after fasting for 8 to 10 hours before eating and 1 to 2 hours after eating. Blood sugar tests can be done in a laboratory or at home using a blood sugar checker, glucometer. Don't forget to record the results when doing the inspection. 2. Maintain intake and diet. A good diet is an important step to prevent and control diabetes. You can maintain the pattern and food intake in the following ways. Avoid foods that are high in calories, sugar, carbohydrates, saturated fat, and trans fats, such as ice cream, sweet cakes, candy, chocolate, processed meats, and fatty meats. Eat high fiber foods, such as fruit, vegetables, nuts, and whole grains, including oats or oatmeal. Drink plenty of water and avoid sugary drinks, sodas, or those containing added sweeteners. Consume food slowly and control the portion size using small plates when eating. 3. Exercise regularly. Not only good for weight loss, exercise can also help you control blood sugar levels and prevent insulin resistance. Therefore, take at least 30 minutes a day to exercise. You can choose light exercise, such as walking, going up and down stairs at home, and yoga. During this pandemic, you should exercise at home so that you can continue to apply physical distancing. 4. Reduce stress. Stress can make it difficult for the body to control blood sugar. To reduce stress, you can try meditation, listening to music, doing hobbies and other things you enjoy, or simply sharing stories with friends and family. 5. No smoking. Smoking can cause serious health problems and increase the risk of diabetes complications, such as heart disease, kidney disease, and retinopathy.